tell me how I'm connected to you and all living things. So, you know, we had a welcome to our traditional territory. I can't do that because my traditional territory is in Saskatchewan and Norway. So I have Métis and Cree on one side and I have Norwegian on the other side. So the first thing I like to acknowledge is all of the nations that are represented here today. And that there was a time in my growing up in years that I had to suppress part of me, and I would not want to make anybody feel that way. So I like to honor all of your ancestors, and that's part of what the singing is opening up the red road, the road between the heart and the head, to bring in all our ancestors to help us with where we are. The other thing I like to think of is 7 directions and how we're connected. From my heart, I'm connected to the air, and all living things need the air. And from my heart and my body, I'm connected to the land, and all living things need the land. And then I am connected to the north, south, east, west, which brings in things I need and takes things out that I don't need anymore. I also want to acknowledge the circle of life, the child, the youth, the adult, the elder. And I want to acknowledge that not as a hierarchy. No age group is above the other age group. We just have things to offer each other. And the elder and the youth are very close because they're closest to the Creator, one coming in and one leaving. I also like to acknowledge the 6 nations of the earth, the nations that I like to honor, and that is the birds, the fish, the insects, the plants, the animals, and the humans. And I like to acknowledge that we need each other. And when we work together in that way, not losing who we are, we become very powerful. So the last thing I would like to say is that from the moment that each one of us is born, my teaching in the Cree world is that we belong, that we have a place and a part to play in this world, not to measure up to anybody else, just to measure up to our own understanding of Creator. With that, I hope you have a wonderful day because you are already wonderful people. Hayachka.
Hello? All right, at this time I'd like to invite Cheryl and Paul Burkhart to the stage to do a welcome.
Welcome. In September of 2016, at one of our local establishments, I met with Tina Coletti of Nelson Mental Health and Substance Use, who is on medical leave right now. Would love to be here, and we're looking forward to her return real soon. And Cheryl Dowden, my co-introducer. Yes, I looked it up. It's definitely not a word. For today, who is also, of course, the executive director of Ankors. We met to discuss what was clearly becoming a great concern for all of us working in our respective fields, the opioid crisis. Unfortunately, all of us had worked in drug events in the past, a hot batch of heroin killing 4 people at a local drug house, a bad batch of ecstasy killing several people at a local club. Although tragic and impactful on the families and the friends of the deceased and our community and our workers, these events in the past had often been short-lived and would subside very quickly. What we saw with this latest crisis was something none of us had ever seen before. And the statistics that have come out of the crisis have confirmed exactly that. The latest report from the Coroner's Service showed that back in 2010, we had a reported 211 overdoses in 1 year. 7 years later, up until the end of September of 2017, we had 5.5 times that number at 1,103, which was an increase of 80% over last year's unprecedented number. 9 deaths in 24 hours in Vancouver, 5 in 10 hours in Abbotsford. It was just, it was something we've just never seen. We knew we had to do something. We knew we had to do it together. As a result of the meeting, it was decided that we would use our contacts through my Chief Constable's Diversity Advisory Committee, which we call DAC, to get together many of the same groups and individuals that we had had been involved in collaborative work in the past in Nelson. Previous DAC was the impetus behind Street Culture Collaborative that Nona Park from Nelson Community Service so aptly ran with and had such great collaborative success in creating the street outreach positions. Okay. And is working hard at having further impact on our community. So I sent out the invitation for the first meeting we held last November at the Legion. It brought together an impressive assortment of interior health workers, including nurses, doctors, administrators, and mental health workers, college and school reps, nursing students, community groups, religious representatives, first responders, including police, fire, and EHS, street outreach and other community group workers, community members with lived experience and their families, and so many more. It was an impressive gathering, but it was nothing compared to our second meeting that brought together even a larger group. Out of the brainstorming from those first two meetings came the idea to create some working groups for our next meeting. Now we've all been part of groups in the past, and as soon as the word working groups comes out, those groups get awfully small awfully quickly, but it didn't. Our first working group brought together 32 people, and they had their sleeves rolled up and they were ready to do some work. We were fortunate to receive a grant from the provincial government through Centre of Addictions Research of BC, CAR-BC, which allowed us to bring in Linda as a facilitator for our groups. Linda has done a great job of keeping us engaged and keeping us on track. And we have the working groups and organizations like Ankors to thank for events such as this forum today. We have applied for further funding, and that funding we'll be looking at continuing to have Linda guide us forward, but we will also be holding some, hoping to get some direction from the larger task force and our smaller working groups about projects and programs that we could undertake to further impact this crisis. And I believe that we are sort of at the forefront of this in this area, so I think what I'd also like us to do is bring in other communities so we can support them as well, because if we do it together, I think we'll be stronger for it. So thanks to Linda and all that she's done, and thanks to all the members of the task force that have stepped up. Thanks to the Ministry of Public Safety and Solicitor General and CAR-BC for the funding we've received so far, and looking forward to getting a little bit more. But right now I'd like to introduce Cheryl Dowden.
Thank you, Paul. I want to start with appreciating everybody in this room, because as I look around, I see a lot of folks that are out there on the front lines. And there are our community support workers, there's outreach, there's EMS and fire and police and folks who are peers, folks that are in the schools, are in the festival scene. And I know that this crisis, this overdose crisis, has impacted so many people in our province and our community. And I love, Donna, that you started with a gratitude for everyone in this room for that reason. Because, and Alex said to me, he said, can you please mention how hard this is for everybody? And, and how everyone is really carrying that in their soul, and how that, and I feel that piece around grief and loss is something that we also need to weave into our response, our community response. So I just want to acknowledge that, and I want to acknowledge the work that all of you do in this community. I know there are people here that have brought folks back from an overdose situation with naloxone. I know that there are folks in this room that have lost people dear to them, and this is hard. I also want to say that our community is incredible, and it's incredibly responsive. I spoke to someone at the paper earlier this week, and they said, "You guys just had an event last week on Wednesday. Why are you having another event?" I said, "Well, it was interesting because our event last Wednesday the room was filled to capacity at the Hue. And today, for this event today, we put out the registration, and it was full in 48 hours. And then all of a sudden, we had a growing waiting list. So I think that's an indication of how people are feeling like we really need to find some solutions in our community to this issue, and how many people are impacted by this. And it's also an indication of how responsive our community is, so thank you. Paul mentioned our fentanyl task force, and I think that's another incredible example of how responsive this community has been. You know, there was the first call out for a meeting, there were 40 people there, the next time there were 60, and then we were breaking into subcommittees and doing and looking at establishing some priority actions for this community. So I just wanted to say that for folks that maybe haven't been involved in that fentanyl task force, you're always welcome to come and join. There are 4 different subcommittees. There's harm reduction that has been working on a variety of actions. One of those things is training local businesses in naloxone. And we have Ryle from Street Outreach here at the back, and he's been doing some of that work. And we have Jamie Macbeth, who's also been doing a lot of naloxone training out there, Alon. And then putting up stickers on local businesses to say that naloxone is available here. And in that piece, I also want to mention that there are so many peers out there that are supporting each other and have brought, back their friends with naloxone, and have gone door to door when they know that their friends are using the bathroom in local businesses, and looking out for their safety. We have another piece that the Harm Reduction Committee is working on is looking at overdose prevention sites, and whether or not Nelson, whether or not there could be a small urban rural model for Nelson. So that's another piece of work that's being looked at. We have the substance use treatment subcommittee, and they're looking at continuity of care and really comprehensive care for people around supporting different avenues for treatment and recovery in our community. We have the first responder committee, which is looking at training for first responders, looking at how to respond to contamination of sites, and we also have the fourth committee is the Prevention Education Committee, and the Prevention Education Committee put on the event last Wednesday. So I think we'll find today that there's still a lot more work to be done in this community, and this is our opportunity too to hear from folks who are involved at a policy level, at the provincial and who are involved with the provincial response to overdose. So I'm going to leave it at that, and I welcome everyone to this event today, and I hope that you get a lot out of it, and I hope to see you at the Fentanyl Task Force meeting, which will probably reconvene in January. Well,
I just wanted to interject that also the funding came from the Community Action Initiative for this event, and there's a committee that worked to get this event off the ground, and if you guys could just please stand up and let people see who you are, Pauline and nurses. We are all part of the task force, so we tried to get people from each of the task force to participate in getting this event off the ground. Thank you.
This works better. All right. Well, thank you for your words, Cheryl and Paul. Those were very inspiring. I was especially impressed by the idea that we're not just a community on our own, that we're connected to other communities that probably have a lot of knowledge and wisdom that's coming out of this that other communities might be able to look to. So I think that was pretty remarkable as well that this event sold out in 48 hours. Do we need bigger conference rooms in Nelson? Is that where we arrived at? It's crazy to think that events or issues like an opiate crisis is what's going to draw a community together, but sometimes it is the hardship that does that. So it's pretty cool to see such a cross-section of people in our community coming together for things like this. So I think it does say a lot, as Cheryl was mentioning, that maybe there's some momentum here and some really good work happening. So I should probably introduce myself. My name is Sarge Hayden. I'm a registered nurse. I work at Selkirk College. I'm an instructor there in the nursing program. Was asked to be your MC for the day. Just want to say thanks to the organizers for asking me to be a part of this. I think this is a very remarkable event to be a part of. Themes of the opiate crisis are pretty pronounced in our province and across the country. Obviously, it's no different here in Nelson. We've got a great list of guest speakers today. We're going to be in for a pretty good day here. We've got Dr. Mark Tyndall, Chris Huston, Ann Livingston, Alexis Crabtree, Dr. Helen Peel, and Jamie McKenna. So be in for a lot of very interesting dynamics here today. I myself am particularly intrigued to hear about Dr. Tyndall's perspective, given my own long history of working in Vancouver previously at the injection site, and a lot of that work in terms of the research was being spearheaded by the likes of Dr. Tyndall. So I always really respected his work and looking forward to hearing some of his words here today. I guess I don't need to acknowledge the Community Action Initiative again, but I'd still like to thank the funders. These things don't happen without that funding, so I want to do that again. So I think without further ado, I'm going to move on to introducing Mark Tyndall, and I'm going to read his biography. So Dr. Tyndall's going to be speaking to us today about the current fentanyl crisis, harm reduction, connecting with others, reducing stigma, and drug law. A lot of stuff here. So we're excited to have Dr. Tyndall, the Executive Director of the BC Centre for Disease Control, Professor at UBC School of Population and Public Health, and Deputy Provincial Public Health Officer for BC. Prior to coming to Vancouver, he was the Chief of the Division of Infectious Diseases at the University of Ottawa, and a Senior Scientist at the Ottawa Hospital Research Institute. His career awards include the Michael Smith Foundation for Health Research Senior Scholar Award and the Ontario HIV Treatment Network of Applied Research Chair. He's authored on over 250 peer-reviewed publications with a focus on HIV care and prevention, drug use, and public health intervention research. Dr. Tyndall received his medical degree and internal medicine training at McMaster University and his infectious diseases fellowship training at the University of Manitoba. He received a doctoral degree in epidemiology from Harvard University with a focus on health and human rights. And from 1999 to 2010, he was a program director of epidemiology at the BC Centre for Excellence in HIV/AIDS and was co-lead investigator on the evaluation of InSight, as I previously mentioned, North America's first supervised injection site. He's conducted numerous community-based research projects, including epidemiological studies of HIV and Hep C transmission, antiretroviral access among people who use drugs, and healthcare utilization among marginalized populations. Dr. Tyndall is a strong advocate and leader for public health in Canada, and he's fostered a number of community-based collaborations that have led to the health policy changes. So without further ado, I'd like to welcome Mark Tyndall.
Thanks, Sarge. You just have to bear with me for one technical moment here. I need to make sure that what we created last night still works. So just 1 second. I wasn't nervous about giving a talk, but I was extremely nervous that it wouldn't work. As Sarge said, I'm currently at the BC Centre for Disease Control, and I've been back at that job for about 3 years, and my whole motivation to take that job was to expand my horizons into bigger public health issues. I was interested in climate change and health and smoking cessation, those kind of things, and I had no inkling that we'd be in this crisis right now that we're in, and because of my background in this, this has been most of my job now, this opioid overdose crisis. So this has caught us all off guard, and it's extremely disheartening for all of us in this room to see what's happened in the last 2 or 3 years. I was very happy to accept this invitation. I've given a lot of talks over the years, but when Alex asked me, I now feel that not only is it an opportunity to give talks and give out information, but it's really an obligation that I feel very strongly about, that people like us in these leadership positions are the ones that are going to make a difference, and that it's we have to do this, and it's not really my choice to say, well, I don't really have time for this, because it's such a visceral crisis for us all that we all really have an obligation to really step up and do this. Having said that, I didn't realize when I accepted an invitation to Nelson that I'd be here until March waiting for a plane. That's the way it goes. It's great to have such a diversity of audience, and I think that it really speaks strongly to what it's going to take to switch this around. So it's not just going to be health, it's not going to be just law enforcement, it's not just going to be housing advocates, it's really a whole bunch of people that could possibly turn this around. And so it's really amazing to see so many people interested in this, and as I say, it's now after you leave this room and the other meetings you're at, it's you have an obligation. It's not just whether you have time for it at this particular time. This is really the issue that we really need to focus on. Things I'll say today hopefully will be a little bit controversial and create some conversation. I feel, again, that's my biggest role, is not just to go through some epidemiology, but to try to introduce some bigger points and bigger ideas that we can really have some frank discussion about how we want to move forward. So I'd like to start off with just a few general comments about how we approach this issue. And it's quite clear with all the people that have rallied around overdose crisis, we weren't all overdose prevention professionals. We've all come into this because of many other issues that have been impacting the poor community and people who use drugs. And one of the key messages I want to give, that these cannot be siloed. So I think HIV really proved to us that we can do a great job of diagnosing and treating people for HIV, but if we don't do all the other things that are driving people's vulnerability to this, then we can't continue just to pick off one thing and another. The latest is HCV. So all of us, we figured out HIV for people who are marginalized. Now let's get everybody treated for HCV. And we see that that is just not a very useful way to view this. And that the things that drive all these things on the slide, and many others that people could think about, HIV, hepatitis C, homelessness, overdose, syphilis, mental illness, these cannot be compartmentalized. The same people that are vulnerable fall into all these categories. So we need to approach this as a general approach to how we meet people where they are and get them out of harm's way. And so there's those of us who have been siloed really need to always be reaching out. That the homeless advocate is the same person as a Hep C prevention advocate, is the same person as a mental health worker, because it all overlaps and it's really the same population, and we'll keep missing the target if we just silo things. The other point that I wanted to bring up is that our approach to drug use. We all know in this room that people who are using drugs and most impacted by the overdose crisis are people who are self-medicating. They're just trying to get by, and all the things, all the harms that are associated with this are not something that people signed up for. So just because they use drugs, they didn't sign up to be abused, sick, homeless, stigmatized, isolated, and criminalized. These are all things that we've done to them because they use drugs. And so we have to continue to remind ourselves that people who have addiction issues and people who are on the street using drugs, that's a problem that we can help them with. All these other problems are things that we've created for them by not allowing them proper housing, by putting people in jail, by arresting people. These are things that we can do something about, and it's very important that we at least reverse the things that we're doing to people. And in many cases, our drug policies are driving much of the harms that are associated with drug use. Being addicted is not the end of the world for people at that particular time. Being addicted, being homeless, and being in jail, those are things that cause crisis for people. So we have to keep reminding ourselves that people are self-medicating for various reasons, various drivers, and that's what we need to work on. The other basic principle is how we view people with drug use. And I think in Canada we feel that we're quite enlightened, that we don't really view people as deviant and illegal anymore. And the police have come out strongly, we can't arrest ourselves out of this problem. But we've swung way over to the other side and medicalized it. So we think that the approach to people is to get them on drug treatment, whatever that means. And we've jumped into the narrative that if only we can get people in treatment, then all our problems will be solved. And we know that the chronicity of people that we deal with every day, that is not the answer for many people. And why they're using drugs is not because they have a chronic brain disease that they need a special medication or a psychiatrist to figure out. Most people in trouble are just trying to get by and coping, and if they could deal properly with their drug use, they really don't have a chronic brain disease. Many of us who have followed people clinically for decades know that once they stop using, or they're okay. You know, their brain is okay. You can use heroin for 20 years and your brain's probably okay. So we've kind of gone to this idea that all people using drugs have their brains fried, and that is not true. Most people are trying to get by, and if they can be in a supportive social environment, sure, drug treatment for a lot of people is very helpful, but this is not the answer. And I think as a medical community, we've really got on this idea that just build more hospitals, and certainly the VPD, the Vancouver Police Department, that's been really their shtick, that we just need to put money into treatment, and without really defining what that means. And for most people, they need a house. That's the best treatment for them. And so this idea that drug treatment's going to solve come and save everybody. There was 22,000 calls for overdoses last year in this province. We were not going to get 22,000 people in a hospital bed to treat their addiction, I can tell you that. So this idea that that this is a medical issue and people's brains are fried is something we really need to push back on and say this is a social issue, and that we need to meet people and help them where they're at. The other basic principle is this is really a demand issue. It's nothing to do with supply. And we're in this mess today with all these overdose deaths because of prohibition. And so clamping down on the importation of fentanyl and carfentanil is a fool's game. So having 1 cent of BC money sending RCMP over to talk to the Chinese is ridiculous in my mind. Maybe that's one controversial statement, but this is nothing to do with drugs coming into our country. This is a demand that will be met somehow. And whether we could take fentanyl off the streets tomorrow, 100%, and it would probably not impact on the overdose deaths because people would find something else that's probably worse. So this idea that we can just by prohibition and continuing to sweep people off the streets that are dealing drugs, continue to intercept drugs at the border will not work. And the whole reason fentanyl's here and not heroin is because it's far easy to manufacture a few chemicals in your basement than to deal with somebody in Afghanistan to get a big load of white powder heroin on the street. So it's because of our ability to intercept these drugs that we're in the mess we're in. And so we have to deal exclusively with the demand issue and meet people and help people who are dealing with their addiction. And any idea that we can fix this problem by intercepting all the drugs is just